I'm Tim Bowling, National Sales Director for Dental and Oral Systemic Testing at Microgen DX. Today, we're fortunate to have with us Mandy Muntz, who is a registered dental hygienist from Grand Rapids, Michigan, and she works at the Practice of Complete Health Dentistry and Integrative Dentistry in that town. What we're going to talk about today is not only oral microbiome testing, but how it's used, how it's fit into practice, and maybe some specifics about examples and benefits that Mandy has seen in her practice using oral microbiome testing. So the first question that comes up to me, and it's a very broad question, is as you all know, every minute of every dental day is planned out in advance. To anyone who would be considering looking at oral microbiome testing and the benefits of it, how do you integrate oral microbiome testing into the workflow during the day, speaking to patients, and how do you make it all work?
Yeah, that's always the question, because everybody, you know, we need more time to talk to our patients. We never have enough time, but ultimately, we're already doing all of the things. We're screening for gum disease every time we see a patient, every hygiene visit they come into. We are the medical history professionals. We're looking at that, you know, screening form, talking to them, seeing what other things we can pull out of them, you know, maybe things that their parents had dealt with or great grandparents even, you know. We'll go back as far as possible in our practice to find out any illnesses or diseases that family or that person, you know, weighs heavy on them. And so once the assessments have been done, we always just sit the patient up and talk about our findings. In the case that somebody has active infection, then we discuss what's going on and how to best treat it. So whether the patient needs root debridement or gingivitis prophy, we include additional home care tools at that point in time. It's really a package deal. And so bacteria testing kind of gets lumped within that initial visit of treatment, where it works best in our practice is we do the bacteria testing at the initial cleaning. And then we often have the patients back for, you know, roughly around a month to follow up and see if there's additional bleeding and inflammation levels. And so at that point, it's a gum therapy program. But like I was saying, testing isn't limited to people with active disease. It can be used as a preventative tool for people trying to get pregnant or going through fertility treatments. It can be used almost like 23andMe to kind of screen for risk markers related to illnesses that one hopes to avoid, so that lifestyle changes, you know, can be made to decrease their odds. And that's where all of our personal conversations come into play. You know, it's not just come in, get your teeth cleaned, you know, you get to know that person in your chair and you care for them. And so that's where we get to hear, oh, I've been hearing and taking care of my mom who's got dementia. Oh, that's important to you, you know, that you already have that in your family. We can obviously test for that and screen if you have any of those bacteria that have been linked to, you know, brain health at that point in time. So it's really a nice flow, but you just have to be open to trying it.
You have to be open to trying it. How, when you explain those type of benefits to the patients, how often do they decide that they would want to go ahead and take the oral saliva screening?
Yeah, often I would say, I mean, the presentation is easy, the testing is simple. And so after the patient understands the problem and the consequences, they're often asking for the solution before I can even offer it. And so I'll explain, you know, what concerns me, and it won't get better on its own, or sometimes it's out of their control and they come in feeling helpless. And so they have another cavity or their gums are still bleeding, even though they've made those lifestyle changes. And that's when I can say, well, we now have the ability to sample the bacteria living in your mouth. And this helps us treat you much more efficiently as an individual. And sometimes we get that report back and the strains, the levels, you know, we learn all this different information off of that report. And now we know different types of medicine to give you that can be treated. And so I often find that people want to know that kind of stuff, just like people voluntarily offer their DNA to go to 23andMe or Ancestry.com to just, we want to learn about ourselves in today's world. We do.
Yeah, it sounds like it's a real practice differentiator for you. I mean, you're really adding a benefit to the patient to be able to find out that sort of thing. When you get the report back from oral microbiome testing, in this case, Perio-DX, how do you go about explaining it to the patient, and then how does that affect exactly what you're going to do as a treatment plan?
So like I said, we have them back maybe a month after their initial treatment if we're actually treating disease, or in the instance of prevention, we'll just have them in to kind of go over the report. And so on that report, it really can bring up a lot of different talking points. Like, I like Perio-DX versus other companies because it will talk about antibiotic resistance, genes that have been detected that the patient wouldn't respond to well had they been given amoxicillin. They're maybe not going to respond very well and still keep some of the bacteria that amoxicillin was trying to treat. So that's an easy talking point right off the top that, gets the conversation flowing. There's a nice bar graph on all these tests. And so you can really just see the levels, and the patient can say, wow, that seems like really high compared to the other ones, or something of that sort. And, that opens so many doors to say, yeah, this is really a bacteria you don't want to have in your body. What can we do is where the conversation goes from there, as to like, how do I get rid of it? And so we're really just preventing future problems, but there are some instances where we're going over these reports and now we're finding that they have just crazy high levels of bacteria that we could do all of the water picking we want to at home, and it just might not go away on its own. The disease would take over before the resolution could occur. And so at that point, we have to, administer antibiotics in some instances, or maybe it just helps us to do more of a probiotic implementation where we're not necessarily eliminating and giving ourselves, the opportunity to decrease our overall microbiome, but we're honing in on the specific bacteria that we want to get rid of, or the specific issues that we're seeing come up on this report. And then we can, make targeted changes to the treatment plan to say, okay, I really have a lot of this bacteria that could weigh heavily on like my ulcer, digestive, colorectal kind of track, and maybe we need a certain probiotic that can help boost those bacteria out. And there's so many different ways to go about it, Tim. Really, there's endless opportunities based on what comes up on this report. Each is so individualized.
Well, it sounds like, Mandy, you do a good job of getting patients engaged. And so
I like that part of it. Yeah, I really do.
When you have the test, what I've heard from others is when they see the results of it, and they have the disease processes explained to them, that it may get them to come back more often, so that you have less problems in the long run, where they may be, if they don't hear anything, they don't know anything's wrong, they'll come back once a year, once every other year. But has it had any effect on increasing the volume of returns for your hygiene appointments?
Yeah, I would say so. And I can't completely blame it on one specific thing that we do here, but we are so education driven, and we give time to our hygienists to educate and explain to the patient so that they have a really good ownership of what's going on in their body and in their mouth. And so once they own what it is that they have going on, they're engaged. And it is a beautiful thing with this bacteria testing ability, just the science that has evolved out of the world, that we can now be, there's a science to treating gum disease. There's a science to treating decay. And so these tests don't just show gum disease things, they show if you have the bacteria that can cause cavities. Right. And so when people feel empowered to make a change, instead of just saying, I've done everything I can at this point, I'm going to give up on my teeth, just give me some dentures, and it's like, yeah, no, like you have a role in this, and you can really make a difference. So it's the empowerment really of it all, Tim. And it's empowering for dental professionals, because now we can play in the same game as all these other physicians and healthcare providers just in general. That's been a big bridge that we needed to cross is there's no metric in dentistry. And
Right.
this gives us the ability to have metric to say that these levels are associated with disease. And so now our other healthcare counterparts, they want to work with us. They want to bridge that gap between dentistry and medicine because the mouth is
Right.
connected to the body. So it's empowering for us in dentistry to be taken seriously and really have, you know, a lifetime effect on other people that we are touching.
You had mentioned that's an awesome point. I remember that you had mentioned to me earlier that you had formed a relationship with a family practice or internal medicine physician in your town. Can you tell us about how that works and how that came about and the benefits of it?
Yeah, it's quite new to us, and we are really just getting kind of our sea legs underneath of us as we're transitioning into this other realm of healthcare. But there's a website, I think it's a website called MDVIP, and Dr. Ritzma, who's the dentist I work underneath, he discovered this recently, and it's where patients can find and get partnered with functional medicine or root cause medicine thinking doctors. And so in their area, they find people who have the same philosophy of care to them. And the doctors in our area in Grand Rapids, Michigan, they recently took a course, the Bale-Donine preceptorship. I'm not sure if you're familiar with that, but
Yeah,
we find that 1 in 2 heart attacks originates with bacteria that stem in the mouth. And so that's huge. And so now we can work with cardiologists and these like-minded practitioners because they're wanting to implement the bacteria testing into their practice, like family medicine or cardio health. And so it's as simple as, you know, swishing and spitting, and these patients come back and they don't know what to do, and these doctors don't know what to do. So it's humbling for us because now we get to help, you know, cardiologists help their patients, and it's humbling for them because they can't do it on their own. They need a dentist who understands the testing, who understands what to do with that information to really treat their patients, because there's no magic pill. We're realizing that, and there's never going to be a magic pill.
there isn't, but having the knowledge to begin with that you already have, and you've mentioned quite a few things, the knowledge that you have and the testing that you do, and you've kind of got some things figured out, like how to integrate medicine. It's probably the last question I'll need to ask is what advice would you give to either a hygienist who's interested in this, because I meet many of them, or a dentist or a whole practice, on how to make what you have made work so well there, how to make that work for them?
I work in a practice where we just dive in head first, whether or not we know all the answers when we're getting into it, but when you know better, you do better. So you can't put your blinders on after you learn about this stuff. You have to do it, whether or not you know what you're talking about from start to finish. You're going to learn as you go. But that's really my advice, is to read the studies and to understand that there is science out there that is evolved. We're not reading textbooks from the 50s anymore. Read the new studies, get excited about the fact that we know how to treat it and it is a science. And yeah, just get your team excited, whether it's the hygienist leading the pack or the dentist leading the pack. This is the future of healthcare, and we can actually make a difference to see healthy people in the world. So if you have that drive and that motivation, just get after it.
I can't say any better. It's been very wonderful speaking with you this afternoon, and I think this is going to be valuable for a lot of people. So thank you for your time, Mandy, and we'll talk again soon.
Thanks, Tim.
Bye-bye.